it's Nurse Jen. I am here to bring you your weekly blog post. I feel safe with all of you, so I'm going to take off my personal protective equipment. So today we're not going to talk about coronavirus. We're going to talk about aminoglycosides, which is an anti-infective agent and considered a broad-spectrum bacterial antibiotic, which is commonly prescribed for infections caused by the gram-negative pathogens. So gram-negative pathogens include your tuberculosis, your Staphylococcus aureus, your MRSA, your HIV, your hepatitis, and your Klebsiella, and then many, many more. There's a long list. So the drugs in this class include amikacin, gentamicin, neomycin, streptomycin, topramycin, and kanamycin. The action of this class is to inhibit the synthesis. So the aminoglycosides bind to the bacterial 30S ribosomal subunits and inhibit the synthesis. Aminoglycosides are poorly absorbed in the GI tract, so we're going to administer these through an IM injection or an IV infusion. Aminoglycosides are polar drugs, so their distribution is mainly restricted to the extracellular fluid. So there's a high concentration of the aminoglycosides that are obtained in the renal tissue. So they're metabolized minimally in the liver and then excreted through the urine, 75 to 90% unchanged when excreted. So precautions that we need to take. We're going to use precaution in these patients that have renal or hepatic disease. It's also a pregnancy class D, so we want to use extreme caution in patients that may be pregnant. We don't want to use them for that. So also we want to take caution in breastfeeding patients, in geriatric patients, in the neonates, and then patients that have Parkinson's disease and myasthenia gravis. Black box warning for this is hearing deficits, neuromuscular disease, and renal disease. So any patient that has a hearing deficit, neuromuscular disease, or renal disease, we want to take extreme precaution and not use these drugs. So contraindications. There's hypersensitive reactions that may occur, and all allergies should be identified before the product is given. So some adverse drug reactions. Most common side effects for these drugs are nausea, vomiting, and diarrhea. And then other adverse reactions include neurotoxicity, hepatic necrosis, renal damage, thrombocytopenia, leukopenia, eosinophilia, and ototoxicity. So some drug interactions. Black box warnings with other aminoglycosides, cephalosporins, and penicillin. So we don't want to mix those drug classes. And then also individual drug interactions may occur with drugs like acyclovir, furosemide, bacitracin, mannitol, and vancomycin. So we also want to take precautions with patients that maybe use alcohol or tobacco with certain medications. So some indications for clinical use. This drug class is used for severe systemic infections of the central nervous systems, also the respiratory system, the GI tract, the urinary tract, bone and skin infections, soft tissues, and anything that's of gram-negative bacteria. This class also may be used for salmonella and then Shegella. So some monitoring that we need to do. We want to monitor for signs of allergic reaction, which can include rash, fever, and urticaria. Then we also want to monitor for renal disease. We want to make sure that we get an accurate urinary output while patients are on this medication. We also want to do some blood studies, which would include ASTs, ALTs. We want to do a CBC, an LDH. We want to check their hematocrit, and then also the bilirubin. So electrolytes if long-term therapy. So if patients are on this for an extended amount of time, we want to do electrolyte panels and make sure that those are good. We also want to monitor for bleeding. We want to monitor vital signs during the infusion. And then we also want to monitor the IV for any thrombophlebitis. We want to take a serum peak at 30 to 60 minutes after the first IV infusion or 60 minutes after an IM injection. And then we also want to do a trough level draw just before each next dose. So some patient education. We want to make sure to teach these patients to drink adequate fluids. We want them to avoid hazardous activities until we know the reaction of this drug. And then we also want to teach patients to report any sore throat, any bruising, any bleeding, or any joint pain. All of these may indicate blood dyscrasis, which is rare. So we also have a black box warning for these to advise patients to report any loss of hearing, ringing, roaring in ears, feeling of fullness in the head. So main takeaways for this. We want to make sure that these patients, that we check for renal disease and hepatic disease, and we want to make sure that these patients monitor for the report of hearing loss, the ringing in the ears, that they may cause ototoxicity. All right, there you go. There's your weekly blog post. Stay safe out there.